diffuse axonal injury. So the questions. So what is the mechanism of action of the diffuse axonal injury? And the next is, what are some of the pathological findings of the DAI, that is diffuse axonal injury? Next is, what are the retraction balls? When do they appear? So we'll find out the answers of these questions and learn a lot more. So firstly, the diffuse axonal injury is the mechanism we are firstly looking at. So it is due to the non-impact rotational acceleration as well as the deceleration injury. Next is, this leads to a deformation of the axons. So leads to deformation of axons, and this is by stretching them. Now we are looking at the pathology of the diffuse axonal injury. So this is nothing but changes in permeability, and the change in permeability is of the axolemma. Next is the axonal swelling. Then comes the intracellular calcium accumulation. Next is the proteolysis and the collapse of the cytoskeleton. Next we look at the retraction balls. So retraction balls are also known as the retraction globes. So they are the bulbous as well as the clubbed. Bulbous or the clubbed axons, and they are seen as early as 12 to 18 hours. And the number of the retraction balls, it begins to decrease. So the number, it decreases. This is after 2 to 3 weeks after injury. And a cluster of microglial cells appear. So a cluster of the microglial cells, they appear, followed by the astrocytosis and the demyelination. Next, in case of the immunohistochemistry, it shows the beta amyloid precursor protein and the most reliable indicator of the axon damage. And this one is seen early as 2 to 3 hours. So now to quickly answer our questions. So what is a diffuse axonal injury? So the mechanism is that there is primarily a non-impact rotational acceleration as well as deceleration injury, and this leads to the deformation of the axons. And what does it do? This is by stretching them. Next, looking at the pathology of the diffuse axonal injury, there is change in the permeability and change in permeability of the axolemma. Next, there is also the axonal swelling, and there is intracellular calcium accumulation. Next, there is also presence of the proteolysis. Then collapse of the cytoskeleton. Next, what we asked was, what are retraction balls? So the retraction balls are nothing but the pathological structures which appear. They are also known as the retraction globes. They are bulbous. As well as clubbed. They are bulbous or clubbed axons. They are seen as early as 12 to 18 hours. Next is the number of retraction balls. They decrease. So the number, it decreases, and the decrease, it occurs after 2 to 3 weeks. So it decreases after 2 to 3 weeks after injury. And other thing to note is that a cluster of microglial cell cluster. So they appear, and this is followed by the astrocytosis as well as the demyelination.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.